So we're going to touch on that. And of course, keep in mind that the program is an interactive program. So of course, any questions that you may have regarding any health issue, we will be glad to, to give you some sort of assistance. As regards to our contacts, head office is Shogunas, first floor of Money Talks building in Montrose, Shogunas, and that telephone number, of course, which will give you access to all of the other offices, would be 222-8261. Again, that's 222-8261. To this, I'll allow you to, of course, remind them of the contacts on your side so that when they need to ask the necessary questions, they'll be able to do so.
The numbers here are 627-3223, 625-2257, and feel free to WhatsApp us 306-1065.
Nice. So, of course, let me say again, we are also live on our social media platforms. We are Batson Associates Limited on Facebook. On Instagram, we are Batson Associates TT. On YouTube, we are Batson Associates Trinidad. And on TikTok, we are Batson and Associates. So, prostate health. The thing is, some years ago, when you hear they discuss prostate health and prostate cancer, problems with urinating, that type of thing, they always used to tell you that, you needed to check your prostate when you reach maybe 45 or 50 years. Of course, we know now you need to check at a much earlier age, simply because we are coming to the understanding where we have a number of persons who are experiencing serious problems with prostate health at very early ages, in 20s, early 30s, that type of thing. So that's the first thing we need to establish, at what age should a man have his prostate checked out. And when I say checked out, a lot of persons don't understand that there are many different ways to determine health of one's prostate. A lot of men really shy away from that because of the digital exam, which is not a comfortable situation where a doctor is basically going to insert the finger to determine how the prostate feels, if it's smooth or rough, whatever the case may be. The thing is, there are numerous tests that you can do that is non-invasive, that is not uncomfortable, that is going to give you a proper look at the prostate. Of course, prostate ultrasound being one. PSAs are used, which is an acronym for prosthetic specific antigen, which is basically laboratory testing, where they look at the blood and they look at the antigens, and they're going to give you a reading where prostate health is concerned. Of course, we know anywhere between 0 to 4 is good. Whenever you begin to go over 4, it shows some sign of issues there. You have ultrasounds, you also have transrectal ultrasound, so that you can get a better view of the prostate. You also have MRIs, you have CT scans. I personally am not a fan of prostate biopsies, and that is something I do hide. And I am not the only medical professional who hold that opinion. So, because I believe if you actually go in there now and begin cutting, you're now in a situation where because the thing is, once you cut the human body, you open up the body to two things, primarily oxygen, and you also open it up to the possibility of blood clots, right? And then, of course, pathogens, which would be either bacteria, virus, fungus, whatever the case may be. So, of course, as I said, there are many different ways to determine the health of the prostate. And with prostate ultrasounds, even the PSA, you could get some sort of indication, and then later testing would, of course, give more information as to regards the condition of your prostate. Now, something that a lot of men need to pay attention to is warning signs, because you do get some sort of indication that the possibility exists that there is an issue there. One, of course, is frequent urinating at night, where you may be getting up 3, 4, 5, 6 times for the night to urinate. Issues associated with proper urine flow. I mean, if you are 60 years, your urine flow wouldn't be necessarily the way you was when you were 20, 25 years. But at the same time, you must be able to realize that there's some cause for concern, especially if it is you find that you have a delayed response. So you might go to urinate and, you're there and you're taking a very long time. You might have instances where you have urinated already and you get a starting, stopping, but delayed aspect of starting, stopping. So, for example, you might start to urinate and then you have an interruption and you have to wait for maybe about 10 seconds, 15 seconds, and then urine comes again. So, you don't get a consistent, steady flow. that is also some sort of indication there. Of course, any pain in that area or any swelling is also a cause for concern. So, with those type of things, you should consult or at least get some advice from your healthcare provider. The thing is, when you look at what is going on in Trinidad and Tobago, especially with prostate cancer, again, we're getting a lot more individuals who are coming with prostate cancer. But as I always tell individuals, cancer doesn't start off as cancer. It never does. It's always some sort of inflammatory situation, because you could be diagnosed with prostatitis, which is infection of the prostate, which can lead to swollen prostate, which can lead to problems with urinating, which could actually lead to situations of urinary incontinence, situations associated where you could actually have stoppage of water, where you may get up to go and urinate, and you get in the urge to urinate, but you cannot urinate. Of course, in a situation like that, that is an emergency, and of course, you'll have to go to the hospital, and a catheter would have to be inserted, and the doctors would have to examine you, run various tests and that type of thing. So, of course, at Batson and Associates, we are advocates of preventative medicine, advocates of being proactive as opposed to being reactive. So that is something that you should do. You are 40 years, you're 35, in my opinion, 30. You should at least have some sort of test done. Okay. As regards to what we do at Batson and Associates, where the nutritional blood analysis is involved, that really gives us a holistic aspect of inflammatory response in the body. We also have the ability to see various levels of oxidative stress breakdown in the body. So that is also something that you can also do for us to, again, determine the situation that you're in, and most importantly, what we need to do to get that situation corrected. So, of course, you could feel free to give us a call or visit those telephone numbers again and locations. We are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. We also in Debe. Debe is the corner of Ramsey Trace and the SS Erin Main Road in Debe. And by the way, let me say thank you to those of in Debe South area who actually came out to our health symposium, which we had at our Debe office on Saturday, the 28th, last Saturday. Excellent turnout, and a lot of persons there were satisfied with the information shared, the necessary coupons that were also given as well. So that is something that we're going to be doing again very soon, and of course we will let the general public know about that. We'll be doing in different areas as well. For the St. James office, that office is located at the Money Talks building in St. James. That number, of course, is 220-8113. That's 220-8113. That is actually Red Edge Mall. My apologies. Okay. One of the questions that we actually have on social media here, Tilbis, you let me know when we have a question, right, sir?
Sure, will do.
Good. And one of the questions is, as it relates to prostate cancer, would a PSA be able to give you that information? And the thing is, with a PSA, because PSAs, which are blood tests specifically for prostate health, can give you significant information. So for example, if you get a PSA of 50, when your range is supposed to be 0 to 4, we know there's a problem. Because for the PSA to be that high, there has to be some level of inflammatory response. And that is where additional testing would be recommended, whether it's ultrasounds, MRIs, CT scans, whatever the case may be. So definitely that is something that you should do to determine if you have a prostate issue. In addition to that, you often find that the symptomology that I mentioned there, like for example, frequent urinating, if you're getting any problem as it relates to even painful urination as well, could also be an indication of sub-level of poor prostate health. So, men have a tendency, they always tend to procrastinate as regards to their health. Women have a tendency, and that's one of the things that we realize with women. Women have a tendency, they check everything. If a female has a headache, she feels she get the cold, she's gonna run to the doctor. Men, of course, sometimes we figure, well, all pain is gas pain, so you might figure, drink some hot tea, go and do some hard work, and problem solved. And that is a Caribbean mentality that a lot of men have, and that's something that we need to move away from, because if you are proactive, look with breast cancer awareness, a lot of things that they share with persons with cancer is that, early detection. Early detection is very important, because with the earlier you detect something is wrong in the body, the easier, obviously, it is to correct that situation. So, men, you do not have uncomfortable situation where you have to go on someone. I mean, and that's debatable in the medical field, because there are some doctors who say that the digital exam is the only exam. I disagree, because at the end of the day, you're going based on somebody's feelings in any way. So if it is, you have 10 doctors who do that examination, and all of them have a different sense of feeling or sense of touch. So, I mean, how conclusive could that be? And that is why you have other means of testing and checking certain things out. Okay, so
A couple questions.
yes, sir.
Yeah, what exactly is a good PSA reading?
Well, PSA, so anywhere in the vicinity of 0 to 4 is good. Usually, if you're getting over 4, as I said, it is an indication of some sort of inflammatory response, and that is something that should be checked out a bit further, as I mentioned, whether it's prostate ultrasounds, MRI, CTs. You could look at that. So that's your range, 0 to 4. Okay.
What is the best way, well, proper way to test for your prostate, a blood test, or the other way that men are really afraid of?
Right? And that's what I was discussing. So the way that men are afraid of, as I said, especially in my experience over the years, I don't believe there is a conclusive test. I don't believe it's a test that should be done, quite frankly. We have so much things in medicine now as it relates to technology, where you could now determine if that problem is there. And the other test is not a deterrent for men, because that is a deterrent. I mean, that is a comfortable situation for somebody to be doing that to you. So, you have the ultrasound. The transrectal ultrasound is a little more, how to put it? Because with a transrectal ultrasound, they actually going to use a probe and insert via the rectum. But the reason why they do transrectal ultrasounds is because when you look at the body based on anatomy and physiology, and there's something I always help men who have prostate problems to understand, your gut significantly affects your prostate. And the thing is, if you have an unhealthy gastrointestinal system, so for example, you're someone who you do not empty your bowels properly, you tend to be dehydrated, you do not drink sufficient amounts of water, you may be someone who smokes, you may be someone who drinks a fair enough amount of alcohol. In those situations, you are now more prone to have a problem with poor prostate health. You're more prone to actually develop prostate cancer. Men who work in things like oil and gas, if it is you're dealing with chemicals, so you might be a farmer, so you do a lot of spraying. You might be someone who involved in painting and those type of things. Once you are exposed to those type of chemicals, you have to be very careful. The current clients that I'm working with prostate cancer, maybe at least 65% of the men are men who are farmers. They would have been spraying things like Roundup and Paraquat and all these things over the years, and the new ones they have and that type of thing. And once you have chemical exposure, remember, chemical exposure is always linked to carcinogens. What are carcinogens? Carcinogens are cancer-causing chemicals. So it means that someone who works in an environment when they handle a lot of chemicals, you have to be very careful. Because remember, those things have heavy metals. Painters, there were some years ago, if it is, you look at the statistics and the studies that they have, men who used to do a lot of painting, because remember, paints long ago especially had a lot of lead in them. And because of that lead exposure in the body, lead is a carcinogen. It can actually cause cancer. So, men, you need to be mindful that you do not have the embarrassing tests to do. There are non-invasive tests that you can do to ensure that you maintain proper prostate health, because we have a serious problem with prostate cancer in Trinidad and Tobago. We also have a serious problem with what is termed stoppage of water, where you could just imagine you get up to urinate and you cannot urinate. You can imagine how painful that is. And that is what happens to persons. And the thing is, a lot of the times, listeners of 106.5 FM, you are none the wiser, and you have reached a situation where the problem is grave. And as a result of that, it is not impossible to help you, But of course, the worse the situation is, or the later you take to detect the problem, obviously, the harder it is going to be to deal with. Early detection is always easier to deal with. So those kind of
Go ahead. We have a question here about the ashwagandha powder. Right?
Okay.
Should you take it should you take it per day, and is it safe to take every day? Also, is it an aphrodisiac?
Okay, good question. As regards to ashwagandha, very good, excellent. However, like with everything else, dosage is important. Measurement is essential. Trinidadians have a way, if they know something good for them, like for example, moringa, they will want to go and take 3 tablespoons of moringa because they figure if the measurement is 1 teaspoon, they figure if they take 3 tablespoons, they'll be better off. No, you cannot do those things. And then one of the problems that people have to pay a lot of attention to is dehydration. A lot of persons do not drink sufficient amounts of water. So if you are in a situation like that, and believe me, there are a lot of people who do not drink sufficient amounts of water. And men, if you want to maintain a healthy prostate, healthy sexual function, you have to ensure that you are properly hydrated. The rule for drinking water is your body weight divided by 2 in ounces. Simple way to calculate that. If you weigh 200 pounds, half of 200 is 100. That is 100 ounces. If you convert that to ounces rather, or liters, it means you're looking at something like maybe about 2.5 liters or something. That's an easy conversion. Put it in Google, you'll get the answer. So the thing is, you have to be hydrated because remember, simple analogy, your urethra and various aspects of the body is like pipelines. So the thing is, if you are not flushing out those, it means you're going to be in a situation. If you do not drink sufficient amounts of water, you are more prone to UTIs. What are UTIs? Urinary tract infections. So if you continually have frequent UTIs, and men get UTIs as well, a lot of people think it's only women get UTIs. That's not the case. Men get UTIs as well. You may have burning while you're urinating and those type of things. And the thing is, because you would have had infection consistently over a period of time, that is going to cause an inflammatory response in the urethra. It's going to cause an inflammatory response in the prostate. It's going to cause an inflammatory response even in the kidneys. So it's vitally important to ensure that you are properly hydrated. As it relates to the ashwagandha again, yes, very good. Potency and efficacy is important. So of course, brands very essential where that is concerned. And in terms of the dosage, it would be different per individual depending on your circumstance. So advice is always recommended there. As regards to whether it is an aphrodisiac, yes, it does have aphrodisiac properties associated with it. It is also an adaptogen, so it also helps with inflammatory response in the body. That is also a product we carry at Batson Associates as well. Yes. Let me, of course, say a good afternoon to my senior medical consultant and blood microscopist, Mr. Villalva, who has just joined me. Good afternoon, sir. How are you doing?
I'm fine, thank you.
Good. So we again discussing prostate health. We know we are, even though it's breast cancer awareness, we could touch on cancer in general. As it, yes, sir. Yes, go ahead, man. Hello.
If you what?
Yeah, because I am not here on this side. I don't know for what reason. I'm not. Yeah.
What could be causing that? All right, listen up. Spoke about that many times. He's asking if you're urinating regular, what could be causing that? Regular urination.
Right, frequent urination. Mr. Villalva, you want to go ahead?
Yes, definitely.
Okay.
Frequent urination can be caused by many different aspects. For example, if the person has an elevated glucose level, if they are diabetic or pre-diabetic, prostate issues to cause frequent urination as well as if they have a urinary tract infection because the body is trying to get rid of the particular bacteria. So my advice there is if the person could come into the clinic and pay us a visit, and we can then break down the necessary information for him and get to some diagnostics there so we can confirm his issues.
Yeah, most definitely. And again, to the topic that we're discussing as relates to prostate health, definitely, because, okay, let me give you a quick example. So let's say you drink water at night, which I do, because some people say you're not supposed to drink water when you're going to bed. That is not true. You're supposed to be hydrated throughout the day. Of course, when you're going to sleep, one of the arguments that people have why they don't like to drink water in the night is they say that they urinate frequently at night. Let me explain something to you. 99% of the people who urinate frequently at night, a lot of the times, it has to do with dehydration. Now, you might say, but that is not making sense. I drink a lot of water. The thing is, you can drink a lot of water, But a lot of the times, depending on the issues that you have in the body, your body doesn't utilize or absorb the water properly. So what happens, because remember when you're sleeping, one of the things that your body do, the purpose of sleep is basically to rejuvenate neurotransmitters in the body. That's one of the primary functions of sleep. Also, the body, while you're sleeping, is rejuvenating itself. It's dealing with certain things. So there's some aspect of cleansing while you're sleeping. The thing is, if you are dehydrated, what you're going to find is that your body's going to, is like it mop up, do some cleaning, we send out water. We do again, we send out water. We do again, we send out water. So you find that you're going to be urinating frequently because the body doesn't have sufficient water to do what it needs to do while you're asleep. Because usually healthy persons, what will happen, you'll go to bed, let's say you go to bed at 10. You might get up to urinate. If you're someone who's well hydrated, you drink your water, you might get up to urinate, let's say at 1 o'clock. And then you might get up to urinate, or you might urinate when you get up in the morning. Let's say you get up like maybe 4, 5 o'clock. That is normal. And that is to be expected. But if you see you go to sleep at 10, you get up 11 o'clock and urinate, you get up 12, you get up 1, you get up 2. No, definitely something is wrong with you. And it is the body telling you, listen to me, something is amiss there. And that is where, we will give you the advice in terms of checking and whatnot. One of the things that I touched on with gastrointestinal health, let me say this quickly. You have to understand that your immediate neighbors is your prostate and your colon. The prostate is basically to the front of the colon. So in a situation where you are not evacuating waste properly, so someone who's constipated, someone who has issue with gastrointestinal problems, for example, you might have GERD, which is gastrointestinal reflux disease. You may have acid reflux. You may find that you constantly have problems with flatulence, bloating. You feel as if your food doesn't digest properly. That is early warning signs of gastrointestinal problem that could become worse later on. The thing is, because your prostate and your colon are very close neighbors, whatever happens in your intestines is going to affect your prostate. I have never met anyone who had a prostate problem that didn't have a poor gastrointestinal health issue. They are connected. And I mean, Mr. Vialva, I know you as one of our senior blood microscopists, usually when we have prostate clients that we're dealing with, you can maybe enlighten persons. What do you usually see in that blood sample?
Well, most times I would see indications of bowel toxicity from the live blood.
Just now, repeat that again.
I would see indications of bowel toxicity in the live blood analysis as well as the dry sample. And it means to say sometimes a person may have a bowel movement or 2 to 3 bowel movements a day, but the volume or quantity of stool that is supposed to be excreted isn't there.
Exactly.
And they have some buildup of toxicity in the bloodstream that is causing some auto-intoxication.
Good. Auto-intoxication. And again, to the listeners of 106.5 FM, auto-intoxication. Prefix auto is self. Intoxication is what? Poison. So what you essentially have is poison circulating throughout the body. And because of the close proximity of the colon and the prostate, you cannot have bowel toxicity and have a healthy prostate. You are going to end up in problems later on. So, of course, feel free to give us a call or visit quickly. Again, those telephone numbers and locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Shogunas. That telephone number is 222-8261. That's 222-8261. Debe is the corner of Ramsey Trace and the SS Erin Main Road in Debe. That number for Debe is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That telephone number for St. James is 220-8113. That's 220-8113. And Tobago, of course, is the Triangle Building in Scarborough, Tobago. That number for Tobago is 226-4553. Keep in mind, we are live on our social media platforms. We are Batson Associates Limited on Facebook. On Instagram, we are Batson Associates TT. On YouTube, we are Batson Associates Trinidad. And on TikTok, we are Batson and Associates. Any questions, sir?
Well, this one is not prostate related.
No problem.
But okay. Person says, good morning. I wake up every morning, been waking up lately for the past month or so with pain under the sole of my feet. So when I walk, it just lasts for about 5-10 minutes or so. Wake up for bed during the course of the day as well.
Okay, no problem. So we'll answer the question.
All right. So that particular issue is classified as plantar fasciitis. Now, what tends to happen is that under the ball of the feet, from the heel and to the frontal part of the plantar, which is the ball of the feet and the heel, has a ligament that gives flexion of the plantar. And when you go to bed, because you're inactive, the ligament will shorten. So when you start walking, you will get, because it has pains there, some sharp, tender feelings as well. But by the time the person have that movement taking place, lubrication starts to take place again, the pains will wear away or subside. So what I would recommend for that person to do is to get like a wind ball, and they can sit and just roll their feet when before standing or doing any movement, and that will increase circulation back in the area there to prevent the pains that they're having.
Exactly. Very good. And in addition to that too as well, poor circulation continues to be a serious issue that we experiencing with a lot of persons in Trinidad and Tobago, especially diabetics. And we do an integrative diabetic clinic where, you get better improvements in terms of your blood sugar levels. If you have problems with your eyes, you tend to start to see improvement with the eyes, because we're actually looking at working on the body from a holistic perspective, which of course always takes into consideration diet and exercise, right? The point is, with that poor circulation issue, that is something, again, persons need to pay attention to. And I always try to admonish persons that if you are a diabetic, diabetes and you is not friends. Diabetes can cause some serious damage to the human body. I mean, I'm sorry for persons when I see the staged, and in some instances they don't know because they just don't have access to information. A lot of persons do not understand dietetics. People believe that everything that they make to eat and drink is food. Unfortunately, it have plenty things out there that is not food. They have characterized it quite correctly as junk food, and that is what it is, rubbish. The thing is, of course, if it is you want to partake in a little bit of rubbish sometimes, all right, if you do 5%, 10%, we wouldn't kill you. But you can't do the opposite where you do 90% and 10% are sensible things. It just doesn't work, simply because the body has rules. And one of the rules that the body has is the rule of inflammatory response. And inflammatory response, we know, is a natural response of the human body. When it becomes an issue when the body is so out of balance that the inflammatory response is excessive. And as a result of that, now you're in a situation where high levels of inflammation in any part of the body is always causes some sort of. Okay. Any questions again on your side, sir?
Yeah, we do have a phone ringing here. 627-3223, 625-2257. Let's go. Hello, good afternoon.
Yeah. Now, for some reason, the person speaking, I'm not hearing on my end at third base, so you'll just repeat. Yeah, I don't know what it is. I don't know if we have a issue with connection or something. You might just.
Go from there.
Oh, okay, right. So it's
blood.
okay. Well, the thing is, your blood is supposed to be of a certain thickness. Usually, you have something. The INR clinic that they usually run. So persons who may have problems, who are prone to clotting, because the thicker the blood is, it means you are prone to have problems with clots. There's an examination that is done known as a Doppler. The Doppler is basically an ultrasound of the legs, which determine, if you may have any blockages, if you have any clots, that type of thing. So if you would have done that blood test, say to him that those numbers are elevated and the blood is too quickly, it could be a number of things. Look at your hydration. Firstly, how much water do you consume? Remember, your body weight divided by 2 in ounces, and then we know the place is very hot. We live in a tropical climate. It means you would have to even drink more. If you're someone outside, you're a laborer, you're mason, whatever the case may be, in that hot sun, it means you need to hydrate even more because you are perspiring, and we know you're going to lose fluids perspiration. Apart from that, you also need to pay close attention to inflammation. So it could be the body telling you that you have some level of inflammation there. I'm a huge advocate of cleansing and detoxification. I just believe that it should be done correctly and under some professional guidance. Because I mean, even though we live in a culture where, years ago, parents used to give us, you used to get a little purge, you used to get your food, that. You find in this time, persons haven't kept to that. And think about it, even though the body has the ability in some aspect, because of the type of food, because of the environment that we live in, the toxicity, because of the jobs that people have, I will continue to always warn people who deal with a lot of chemicals. Women who are nail techs, women who are hairdressers, even men, because there are men who are hairdressers. Once you deal with those level of chemicals, even if you're following what would be your health and safety guidelines with your masks or whatever the case may be, people who may work on various plants and that type of thing, you are not doing yourself any favor if you do not cleanse and detoxify your body. I have seen cancer in persons on numerous occasions, and if it is you look at the job that they do, I mean, you don't want to end up in a litigious situation. I cannot say and would not obviously say, listen to me, because of the way you're working, that's why you say. However, common sense may be for book. If you are exposed to certain types of, let me give you an example. Let's say you're working in a gas station, right? You're dealing on a daily basis, you inhaling that. You honestly think that you should not do a cleanse and a detox at least every 6 months or every 3 months or every year? If you're someone who consumes large amounts of meat, there's some people that love meat. Every day you have to eat meat, and they're eating everything. They're eating pork, they're eating whatever the case may be. And I am not necessarily an advocate of vegetarianism. That's not what I'm saying. But what I am saying, meat has a lot to do with breaking down in the digestive system. Protein takes the longest to digest. So if you're someone who consumes large amounts of meat, you always find people who like a lot of meat are usually hypertensive. And the reason for that is because of all the nitrogenous waste that the body has to get rid of. That is going to cause the blood to thicken. It's going to cause problems with inflammation in the blood. Yeah, you're going to have problems with that. So that's something to pay attention to.
Dr. Batson, I totally agree as well as it relates to the inflammatory response for last caller. If that person had any illness of recent, it could also increase their platelet count, and that can cause some
thrombocytosis as well. Okay, right. Good. So, of course, feel free to again to give us a call or visit that number for Shogunas office, which is located on the first floor, of Money Talks building in Montrose, Shogunas. That number again is 222-8261. That's 222-8261. Any more questions to this?
No, sir, not yet.
Okay.
Oh, wait, yes. Hello, good afternoon. He's asking if you drink a lot of coffee during the day, if that will cause you to urinate a lot at night.
Yeah, of course it's going to. In fact, I mean, I'm not gonna lie to anybody where that is concerned. I mean, coffee on a daily basis is not a healthy thing. I don't care however you want to put it. And the reason for that is because coffee is a diuretic. So the answer is yes, coffee causes your body to lose sodium from a biochemical perspective. And once you lose sodium, the next thing that is going to follow sodium is water. That's the basic chemistry that diuretics are basically made on. So someone, for example, who might be hypertensive, they might recommend something like Lasix or Benadryl for you. And the purpose of that is exactly that. When sodium leaves, water follows. Okay. So, I always tell persons, yes, coffee is something that you may like. Coffee is something you might be accustomed drinking, but there are certain health challenges that excessive use of coffee is going to cause. And one of those is exactly that, dehydration. So, limit your amounts. Be practical in the situation. I tell persons, if it is you could do it, you don't need to drink coffee every day. If it is you do it maybe once a week or something like that. The thing is, abuse of anything, the old people have a saying, too much of one thing is good for nothing, right? And that's the problem. You cannot use it in excess. So it's something to pay attention to. It can contribute if it is you are hypertensive, if you're someone who has arthritis and those type of things. Coffee is going to make your life more difficult because of that dehydration situation, because it is also a stimulant. All stimulants affect the central nervous system and can cause serious problems with anxiety, problems with insomnia, problems with even cardiovascular health, poor cardiovascular health as well. So definitely you need to limit your amounts where that is concerned. Keep in mind again that we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates TT. And on TikTok, we are Batson and Associates. So, of course, feel free to share us, like us, and that telephone number again, which will give you access to any of the offices. If you need to come in and have a consultation, have your blood analysis done, your magnetic resonance analysis done, if you may have called as regards to any problem that we're discussing with prostate and you have ultrasounds, you have PSAs, you have biopsies, whatever the case may be, you can walk along with those in addition, to have yourself looked after. That number again, 222-8261. That's 222-8261. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. I'm joined this afternoon by Mr. Stefan Vialva, our Senior Blood Microscopist and Consultant. And of course, we're discussing health. It is now 1:55, sir. Do we have any more questions on your side?
Yes, we did have a question.
Yes, sir.
The phone line was ringing, but they went offline. 627-3223, 625-2257. Once again, you're listening to Batson and Associates. Feel free to call us back.
Yes. In addition, well, there's a question we have here on social media, so I'm just going to tackle it on our Instagram. This person is asking, this Samuel 52 is saying, good day, what is the best way to heal hemorrhoids or piles? So, Mr. Vialva, you want to take that?
Definitely. All right. So hemorrhoids is basically
I switch it.
So hemorrhoids is basically where the veins of the anal area becomes very aggressive in terms of swelling.
Right.
So it becomes inflamed due to constant constipation. Now, sometimes some persons may have diarrhea and they can also get hemorrhoids as well.
Right.
Because there's hemorrhoids externally and internally as well.
Right.
Okay. So constant diarrhea can cause the internal hemorrhoid to become inflamed because of that constant movement there. So definitely what I would recommend for the person as a home treatment, they can get Irish potatoes. They slice the potatoes in that circular shape, and they can place it on the anal area in the nighttime when going to bed. And it will reduce the inflammatory response as well as our inflammation formula as well from an internal perspective.
Definitely. And again, too, as well, hydration. One of the reasons why a lot of persons, because if you look at the gastrointestinal system, the colon is approximately 23 feet in length. You have your ascending, your transverse, descending, sigmoid colon. The thing is, your colon is not stretched out in one line that is 23 feet. It is wrapped up. So because of that, you find that fiber as well is very important. You have two types of fiber. You have soluble fiber, which actually helps to reduce or to maintain healthy blood glucose levels. And you also have insoluble fiber, which actually reduces the transit time of waste throughout the body. So it actually makes you defecate better. It helps to rub on the lining of the intestines to prevent you from getting things like piles and hemorrhoids and those type of things. There's a product we carry as well called Santulan, which is a 7-channel detox. Very easy product to use. Of course, you could always call the office and get the necessary advice as regards to that. But what it really does is helps is improving blood circulation, but it also cleanse and detoxify kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. And the good thing about that, there's a liquid. It's not any set of pills that you have to swallow or anything like that. So, liquid always is easily absorbable, surface area to volume ratio, so it goes through the gastrointestinal system very quickly and does exactly what it needs to do. So again, you could always feel free to give us a call or visit. Those telephone numbers again are 222-8261. That's 222-8261. Debe is the corner of Ramsey Trace and the SSA Reed Main Road in Debe. That telephone number is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. Keep in mind, we have open clinic days and walk-in clinic days for all of those offices. If it is you doing our diagnostic package with the live nutritional blood cell analysis, the magnetic resonance analysis, dry blood analysis, that consultation. You can, of course, if you plan on doing that and you plan on walking in, then you ensure that you fast for 2 hours. And that is important so that we'll be able to get the necessary information, take the blood, and of course, make the necessary recommendations for you. Tobago is the Triangle Building in Scarborough, Tobago. That number for Tobago is 226-4553. Keep in mind that we are live on our social media platforms. We are Batson Associates Limited on Facebook. On Instagram, we are Batson Associates TT. On YouTube, we are Batson Associates Trinidad. And on TikTok, we are Batson Associates. As we always say at Batson Associates, if you think health is expensive,
try sickness.
If you think education is expensive,
try ignorance.
Mr. Tilbase, always a pleasure to the listeners of Freedom 106.5 FM. Thank you very much for your time. Do enjoy the rest of your afternoon. Until next week. Take care, sir.
Take care.
Yes, social media. So you all see that we were very busy on the radio there. So of course, let me say a pleasant good afternoon to Miss Annabella Bay, Miss Netta Cooper, Miss Wendy, Miss Nicola Hood, of course, who is out there in Antigua. Always a pleasure to have you, Miss Marge Hills. So guys, so we will be taking our exit here. Of course, we will excuse me, we'll join you guys shortly for by 2:30. Which is when we're going to be joining DJ Mamu. So we'll be joining DJ Mamu. Usually it's 2:15, but it's going to be 2:30 this afternoon because we just have some things we need to sort out. And that'll be DJ Mamu Radio TT.com. And we go from 2:30 to 3:30. Okay, guys. So as usual, keep in mind those telephone numbers, the locations. Our symposium that we had in Day, great symposium, Saturday the 20th. Tobago, we have not forgotten you. I see somebody in Tobago actually mentioning there. In fact, Miss Marshall actually gave me the information for Tobago. So what I'll do, guys, I'm gonna let Shakil do some stuff for us on our social media to let you know when we come in Tobago, the days, and of course I'll mention it in the next program. We'll be in Tobago this month, God's willing. So take care, guys, and of course our next program is with DJ Mamu on DJMamuRadioTT.com, and that program is going to be from 2:30 to 3:30. Take care, guys. God bless.
Take care. Bye.